Hey y'all, it's Corinne here.
And Marlise, hi.
And we are the Nursing Spectrum, and today we have a very special combined mental health and midwifery Monday video for all of you. So we touched on it a little bit last week. We are going to discuss intimate partner violence today, which is very important and very prevalent in the news as of lately. We are going to get down to the nitty gritty and, discuss some things that maybe you guys feel like you should know. So first, I'm going to touch on the trivia question that was asked last week, which was, one in how many men and one in how many women experience intimate partner violence every year? And it is...
The answer is 1 in 3 women and 1 in 9 men in the U.S. experience IPV every year. So shout out to y'all if you got the answer right. So I'm going to talk about the definition of intimate partner violence, or what we will be referring to as IPV. So it is defined as the physical, sexual, or psychological harm done unto you by a current, former partner, spouse, or significant other. And this is a public health issue that's not only affecting the U.S. but the world. It affects everyone. It affects women, it affects men, gender non-conforming folk. It affects people in heterosexual couples, couples that fall on the LGBT spectrum. It's a public health issue, and it takes many forms.
So there's going to be like 4 different forms that we're discussing today, which is physical, sexual, stalking, and psychological aggression. So physical is, like putting your hands on someone, of course, shoving someone, pinching someone, anything that can harm somebody, like use of a weapon or force against someone. Next is sexual, and that's going to be penetration, rape of a victim that is unwanted, unwarranted, any type of sexual contact, and that's, self-explanatory. Then we're going to go into stalking, and stalking is, constant and repetitive actions to get someone's attention that they don't want. So if you're blowing somebody up, stop blowing them up. If you're sending them these emails, stop doing it, because you're stalking them, and that's intimate partner violence. And the last one is psychological aggression, and that's going to be, verbal or nonverbal communication, which is used to exert, some type of mental, emotional control over someone, make them feel some type of way, make them feel bad. So if you're saying hurtful things to someone that can really bother them mentally, you are participating in intimate partner violence. So prior to the 1970s, you guys, domestic violence was really not considered a crime. It was considered more of a private form of violence that was kept in the house in between families. So if your father was abusing your mother, you better not leave the house and go tell anyone, because that's not what you were supposed to do back then. But in 1994, however, the Violence Against Women Act was created, and it was revolutionary. It encouraged states to reform their criminal justice systems to include guidelines on mandatory arrest and prosecution against abusers.
So for the sake of this video, we're going to narrow our population down to women, and in particular pregnant women. And why women? So it turns out that 95% of all IPV cases against spouse or partner, 95% of those cases involve women. And to even further specify that statistic, each year 1.5 million women experience IPV in the US, and 324,000 of those women are pregnant when they experience that abuse.
Also, interpersonal violence is the leading cause of female homicides and injury-related deaths during pregnancy. 37% of pregnant women are battered during pregnancy, including blows to the abdomen.
I want to describe our population of pregnant women who experience IPV a little bit further. So what are their risk factors? What puts women at an increased risk for IPV during their pregnancy? There's a slew of them. A lot of them you've probably heard. So risk factors include lower socioeconomic status, younger women, so adolescent women are in particular at risk, single, unmarried, so low educational attainment, minority women, in particular Native American women and African American women are at risk. And then even the neighborhood that you live in can put you at an increased risk for IPV. So if your neighborhood has a higher proportion of residents who are unemployed or who make a lower income, or if the neighborhood has loose social ties, so not a lot of parks or community groups or poor infrastructure, like not a lot of chance to talk to other people in your community, all these things in your neighborhood put you at an increased risk for IPV during pregnancy. And so then what are the complications? What are the adverse effects of IPV during your pregnancy? I'm only going to talk about one complication and kind of break that down. So women who experience IPV during their pregnancy are more likely to deliver prematurely, and they're more likely to deliver a baby that is considered low birth weight or small for gestational age, which then puts them at risk for perinatal death, which also puts them at risks for long-term outcomes, so like long-term consequences, so like cognitive, behavioral, psychological consequences down the line. And how does this happen? So there's the physical abuse that a woman experiences. So if she gets hit in the abdomen, that could lead to a premature rupture of membranes, uterine abruption, or placental abruptio. Women who experience IPV are an increased risk for UTIs, STIs, HIV, especially if their partner cheats on them or forces them to have unprotected sex. This can then do damage to your fetus. And then there's the mental health issues that accompany IPV. So women are at increased risk for stress, anxiety, depression, PTSD, and then that could lead to not seeking prenatal care or not gaining enough weight. It could lead to substance and alcohol use or smoking. And then all of this stress then exacerbates the already stressful condition of pregnancy, and it can exacerbate conditions such as gestational diabetes or hypertension.
So what can we as providers, as nurses, as family and friends do to help the victims of intimate partner violence? It's very important that we stay involved in community outreach and educational programs, you guys, so we can help people understand the different signs and forms of intimate partner violence. Because think about it, if somebody does not know that they're being victimized, they're not going to want to go seek help. So it's important that we help these people understand what's going on. We also need to prioritize the voices and the experiences of the victim, you know. We want to take the blame off of them and make sure that we are holding the offender accountable so this is not a reoccurring cycle. We also need to resist re-traumatization of the patients, because there are certain words and certain experiences when they are being discussed with someone that may cause distress in that person. So we have to be aware of these trigger words and of these situations when we are talking about certain things. There's emotions that are running crazy in people who have gone through situations like this, and you know, you personally may have not gone through anything like this, so you may not understand, but you know, you have to be empathetic, you have to be caring, and you need to be patient with people, because they may not be so forthcoming like you want them to be about certain details of their experience. So if you develop, you know, this therapeutic relationship with this person, develop some rapport, maybe they'll be more willing to express more details that are going on. We want to provide resources for women and their families or anybody who has been affected by the situation, and that can be anything like food, you know, refer them to a battered women's shelter so they can escape their abuser. We want to maybe help them out financially so they can have what they need to get through the day. And that's any type of support that can help this person continue on with their normal life. So as a provider, it's important that we start the conversation. We cannot wait on the victim or the patient, because like I said, they might not be forthcoming about what's going on. So you want to directly ask the question. Don't, you know, beat around the bush, and explain to them why you're asking them, because you don't want to offend somebody when you're asking questions like, have you been a victim of intimate partner violence? But it is an important discussion that we need to have.
And finally, we want to support women, we want to listen to women, and we want to respect women as they tell their stories and they reclaim their power. We want to remind them that healing is possible and that they are not alone.
So thank you guys for tuning in to this segment of Mental Health and Midwifery Mondays. We hope you guys enjoyed it. And if you have any questions, feel free to comment below or send us a DM and we will get right back with you. So thank you so much for tuning in.
Bye.